Fibroids, also known as leiomyoma, is benign tumor of muscular and fibrous tissues, typically developing in the wall of the uterus. It is thought they occur more often in overweight or obese women because being overweight increases the level of estrogen in the body. Women who have had children have a lower risk of developing fibroids. Fibroids can grow anywhere in the uterus and vary in size considerably. Some can be the size of a pea, whereas others can be the size of a melon. The main types of fibroids are 1. Intramural fibroids. The most common type of fibroid, which develop in the muscle wall of the womb. 2. Subserousal fibroids. Fibroids that develop outside the wall of the womb into the pelvis and can become very large. 3. Submucosal fibroids. Fibroids that develop in the muscle layer beneath the womb's inner lining and grow into the cavity of the womb. 4. In some cases, subserousal or submucosal fibroids are attached to the womb with a narrow stalk of tissue. These are known as pedunculated fibroids. If your doctor thinks you may have fibroids after performing the exam, there are several tests that can confirm the diagnosis. The first is usually an ultrasound. The other tests are more specialized and are only performed if needed to guide treatment option. Fibroids do not need to be treated if they are not causing symptoms. After the menopause, they'll often shrink without treatment. If you do have symptoms caused by fibroids, medicine to help relieve the symptoms will usually be recommended first. If these prove ineffective, surgery or other, less invasive procedures may be recommended. A myomectomy is an operation to remove fibroids while preserving the uterus. For women who have fibroid symptoms and want to have children in the future, myomectomy is the best treatment option. Myomectomy is very effective, but fibroids can regrow. One of the main tests carried out to diagnose fibroids is an ultrasound scan. Ultrasound. If confirmation is needed, your doctor may order an ultrasound. It uses sound waves to get a picture of your uterus to confirm the diagnosis and to map and measure fibroids. Two types of ultrasound scan can be used to help diagnose fibroids. An abdominal ultrasound scan where the ultrasound probe is moved over the outside of your tummy, abdomen. A transvaginal ultrasound scan where a small ultrasound probe is inserted into your vagina. Ultrasound. Many women are familiar with ultrasound from pregnancy when it is used to evaluate the growing fetus. Ultrasound is also a safe and reliable way to look for fibroids. In the test, sound waves are used to create a picture of the uterus and ovaries. Ultrasound does not use radiation. The procedure takes between 30 to 60 minutes. The initial portion of the exam is performed with a transducer on the abdomen. Conducting gel is placed on the skin, which feels wet and cool. The transducer is moved around as the technologist takes pictures of the uterus and ovaries. The second portion of the exam is performed internally. You will need to empty your bladder first. A special ultrasound probe will then be placed in the vagina. It is usually not painful and is inserted like a tampon. Close-up pictures are then taken of the uterus, endometrium, the lining of the uterus, and ovaries. The technologist reviews all the pictures and will report the results to your doctor. Images produced by these scans are transmitted to a monitor, so the doctor can see if there are any signs of fibroids. Whether a fibroid is symptomatic or not depends primarily on its size and location. During ultrasound examination, fibroids usually appear as well-defined, solid, concentric hypoechoic masses that cause a variable amount of acoustic shadowing. In general, large fibroids can compress the surrounding organs and tissues, for example the bowel, bladder, or pelvic ligaments, causing constipation, dysuria, or even back pain, by compressing the lumbar plexus. Large fibroids may also be palpable through the abdominal wall. Some fibroids may inhibit normal vaginal deliveries, causing hemorrhage or ulceration in the case of cervical localization. Submucosal fibroids may cause heavy bleeding if they protrude into the endometrial cavity and are usually the reason for long painful menstruation, with blood clots or abnormal uterine bleeding throughout the menstrual cycle. God bless you as we learn. If you don't understand any aspect, feel free to send your questions. Subscribe please for updates and follow up. Jesus.